Okay, we are going to talk about rheumatoid arthritis. Rheumatoid arthritis is an autoimmune condition that affects multiple joints, causing inflammation due to an autoimmune attack on the synovium of the joints. Joints that have synovial membrane are joints that where we find two bones are attached to each other, and the synovial membrane is the membrane that is in between the two bones to help keep the joints steady and also protect the two bones from attacking each other. So usually rheumatoid arthritis is a symmetrical condition. You find that same joints are affected on both sides of the body. If it is the wrist, you'll find both wrists are affected, and the affected joints become stiff, they are swollen, they are stiff, and usually the pain is worse on waking up in the morning. So the patients will have pain, and they will have difficulty using the joints, and usually this happens early in the morning. So once the synovium is affected, it is thickened, and then there is formation of a pannus, and then leads to cartilage destruction, and then there is destruction of the two bones that are joined together. The joints that are usually affected include the fingers of the hands, the proximal, and also the distal joints, the wrist. It can affect the elbow, the ankle, the joints of the foot. It can also affect the neck, the shoulders, and also rheumatoid arthritis is a systemic disease. Can affect other organs like the heart, the skin, the lungs, and usually you have general symptoms whereby you have find the patients have anemia, they have general body malaise, sometimes they may have fever, and they have a general feeling of tiredness. The most important thing in the treatment of rheumatoid arthritis is early diagnosis to prevent the joint damage, because if the disease progresses, then you have deformation of the joints, and the patients might lose the functions of the affected joints. If it is the heart that are affected, you will find that there is deformity of the hard joints to an extent that patients have difficulties like buttoning their buttons, doing fine hard movements, which makes the life achieving the daily activities of daily living of these patients becomes very difficult. So the diagnosis of rheumatoid arthritis is usually from the history, as we have said. It affects both joints on both sides of the body. There is swelling, there is warmth of the affected joints, and there is also tenderness. Then there is also a genetic predisposition. Usually for individuals who have this problem, you find that there is an interrelationship between genetic predisposition and the environmental factors. Then there is also the tests that are done to make a diagnosis of rheumatoid arthritis. The first one is rheumatoid factor, whereby you can find that rheumatoid factor is positive in a good percentage of patients, but there are also patients who have rheumatoid factor negative rheumatoid arthritis. They usually have a raised ESR, which is estimated sedimentation rate. C-reactive protein, because this is an inflammatory process, might also be high, and there is also the anti-CCP test, which also is usually elevated. X-ray of the joints will show joint damage, and you may have also deformities of the joints. So the treatment of the problem is usually, first of all, is supportive. Supportive is when the patients have a flare-up, then you rest the joints. Then you can also do cold or warm massages depending on what the patient is comfortable with. And then also there is use of the supportive devices to support the joints to avoid excessive trauma and excessive movement of the joints. Then in acute flare-up, you have use of anti-inflammatory drugs like NSAIDs, drugs like brufen, diclofenac to help with the pain. There is also sometimes they need to use steroids to help reduce the inflammation. And then the mainstay of treatment of rheumatoid arthritis is the drug modifying and rheumatoid arthritis drugs, which include drugs like methotrexate, sulfasalazine, and also leflunomide. For advanced conditions, then there is room for surgery, whereby patients might need arthrodesis or of the joints, joint replacement if the disease have progressed too much. So we also encourage patients who have rheumatoid arthritis to exercise, especially low impact aerobic exercise like walking, bike riding, which will help to keep the muscles around the joints strong. Then for those who may have anemia, then it's necessary to give hematinic to collect the anemia. And also remember that these patients are on anti-inflammatory drugs like brufen, diclofenac, which might cause bleeding from the stomach and the GI system, and they may need use of drugs to help to stop these tendencies to peptic ulcer diseases. So the most important thing in the management of rheumatoid arthritis is, one, early diagnosis and the use of drug modifying agents, encouraging patients to keep active so that they keep the joint strong, and also maintaining good nutritional status, because excessive body weight will lead to excessive pressure on the joints, which leads to more trauma to the joints and the damage to the joints. So thank you very much. Thank you for listening to me.